Alright, so Escherichia, Enterobacter, Proteus, Klebsiella, Shigella, these are all members of the enteric family. And then other microbes that we've mentioned so far can also be seen in the large intestine. Lastly, for the urogenital system, right, we expect to see microbes that are coming from the large intestine and from the skin to populate the urogenital system. But majority of these, or most of the microbes that are dominating the urogenital area, are those that are capable of those that are capable of tolerating acidic pH, slightly acidic pH. You know, for females, very popular microbe seen in the urogenital system of females is the parasite, the protozoan Trichomonas vaginalis. Alright, so let's now move forward and continue the discussion on the process of microbial infection. So, I think in Learning Unit 1 in Module 1, we've talked about Koch's postulate, which serve as our evidence in proving that microbial infections are caused by microbes. No? So the principles or the postulates are easy to remember. And for review, let's talk about these postulates once more. So, the pathogen causing a disease or causing a particular disease, if you are to search for it, must be present in every carrier of the disease. So the pathogen should be present in all persons infected with the disease. When these pathogens when the pathogen will be isolated, right? The pathogen can be acquired in pure culture and can be grown in the laboratory. In the lab, the pure culture will be grown, and if the pure culture will be inoculated to a healthy, susceptible host, we expect that the infection present in the original carriers should also be produced by the inoculated animal or the inoculated carrier. Lastly, if we will be extracting the same pathogen in the inoculated laboratory animal, the pathogen should be retrievable. So the pathogen should be acquired from that healthy laboratory animal. So here we're seeing a diagrammatic representation of the processes that outline Koch's postulate or Koch's postulates. Right? Though there are cases in which the normal routine of associating infections with microbes cannot be proven by Koch's postulates. Because now we came to or we come to terms that there are some microbes that cannot really be grown in the laboratory. Some diseases may be caused by a combination of microbes, and some microbes can cause a variety of diseases. So these are important things that we have to remember, because not all microbes may be grown in the lab. Not all microbes and the disease that they cause can be proven by the use of Koch's postulates. Uh-huh. Okay, so we're done with this. All right. So let's talk about disease classification and codification by examining few things like vocabulary. How do we measure diseases or the rate of disease existence or disease statistics? And how do we recognize the presence of disease and the patterns that they manifest? Okay, let's first talk about a few vocabulary terms. First is symptoms. Okay, so symptoms refer to change in the body function. Normally, these symptoms are subjective, so there's no mean or there's no quantitative way to measure a symptom. For example, pain. Okay, if the doctor will ask the patient how